Good afternoon, everyone. Dr. Sondos Samargandy speaking here. It's an honor to have Dr. Muhammad Al-Rashidan. He's a cardiac surgeon. He's a director of Heart Center in KFMC, Saudi Arabia, Riyadh. It's a pleasure, Dr. Muhammad, to have you with us. So, without any further ado, I'd just like to ask you, what are the recent advances in valvular heart treatment from the surgical perspective?
Thank you, Dr. Sondos. It's great to be here today in GIS 2024. I'm really excited and thrilled, and the program is very enriched, and there is a great involvement of cardiac surgery in the program. Well, I mean, talking about valvular heart disease, the landscape of valvular heart disease is keep changing with the new advancements. From if we're gonna focus in surgical now most of the new advancement in valvular heart disease comes actually in two dimensions. Dimension number one, working in the access, how can we do the operation with less invasive and excellent outcome, and a dimension from improving the prosthesis. What's the new technology of preserving the valves and the biodegeneration and decrease the calcification, especially in the tissue valves, and in the mechanical arena, how can we develop mechanical valves that does not require an anticoagulation? So you give a patient prosthesis without medication. So if we're going to talk about approach, now we can provide the patient with a single valve, double valve, and even triple valve with a minimal invasive approach. For example, if you talk about aortic valve, we can do that through mini sternotomy, anterior thoracotomy, transaxillary. We can do the mitral valve now robotic. We can do it minimal invasive direct vision. We can do mitral aortic with transaxillary approach or robotic. We can do triple valve minimally invasive. So I think the direction is to go more of minimal invasive, and the direction to go to have a prosthesis that lasts forever or like last as long as possible.
So the conventional thinking that it's an open chest. Is it an open chest anymore?
Well, I know we don't really. I personally don't like to open the sternum. I always looking for an alternatives for like going for like a axillary thoracotomy. Or if the patient is not a candidate for surgery, we can provide them with a transcatheter therapy that also require a small incision in the chest. It's like a tendine valve transcatheter mitral valve.
Or is it like in other tier procedures, like you can go from a transfemoral? So now we have both options going on. I mean, it's very fascinating the time we're living in conventional opening the chest, and now we have like 5 centimeter open that you can fix the whole valve under 3 hours even, or 2 hours, and without requesting sometimes a pump or, support. Am I correct or not? You don't need it most of the time.
No, if you do it a conventional surgery, like you have to go for a pump, you cross clamp, but you do it from the small incision.
Oh, okay.
But if the patient is not a good candidate for a pump, or is a high risk or old age, then you provide him with alternative options. He's going to go with a transcatheter therapy, such as TEER, with anesthesia expertise. If the patient is not a candidate for TEER, then we start thinking about going for the transcatheter mitral valve replacement.
Okay. Awareness. Let's talk about the awareness. Do you think our population and normal people aware about the options now? Because the conventional thinking is, as I said, open chest. But now you mentioned multiple, strategies that you have: minimal, lesser, shorter stay at hospital. How can we spread the awareness? I mean, do you think social media is one of the platforms that we can advocate and we inform the patients about these procedures?
This is a great point, actually. I think, to be honest with you, we're not doing as good as in publicizing about the new advances. However, I think social media is a major role, because now we can reach to a much more audience through the social media platform. For example, they can reach us through GIS, different platforms. They can reach through different platforms such as X, Snapchat, LinkedIn.
I mean, you have some of your own accounts.
Yes, I have my own account. Yes, they can just
Google your name.
They can Google, or also we sometimes try to publish our surgical outcomes and even transcatheter outcomes into the social media platform, so in the public arena, so people can reach more into and learn more about the procedures.
Okay, that sounds good. Any final advice to the audience and us?
I think we live in, as you said, in a very fascinating time. I think from surgical and intervention, we complement each other. We should put hands to hands, move the field more, and I think our patient deserve to have all options.
Exactly. It's a hard team.
It's a hard team.
It's a hard team. It's a hard team decision. With that, we thank you everyone for tuning in with us, and we'll see you soon. Bye bye.